Hello everyone. Today we are talking about bariatric surgery. Are you morbidly obese, or have you been dieting or intermittent fasting and yet this hasn't worked? Well, you are not alone. And a lot of people around the world suffer from obesity, which have many complications such as cardiovascular disease and stroke. Of course, there are many ways and treatments for obesity. One of these treatments are bariatric surgery. Bariatric surgery involves making changes to your digestive system to help you lose weight. In this video, we're going to talk about the surgery, the reasons for resorting to it, and how it works, in addition to the possible complications of the surgery. Our role today is to answer your questions regarding bariatric surgery. Today we have Doctor Seo, who is a leading doctor at Seoul St. Hospital. He's going to discuss with us everything about bariatric surgery in an experienced medical point of view. Hi, I'm Ume. Before we start, please subscribe to our channel so the next time we'll be updated with our new releases. Moving on to bariatric surgery.
네.
So what is exactly bariatric surgery?
Obesity has been classified as a disease. As a result, bariatric surgery was initially for cosmetic purposes, but obesity became a disease and was well developed for weight loss. As a patient lost weight and nutritional status was found to be balanced due to surgery, the accompanying metabolic syndrome, such as dyslipidemia and diabetes, became effective. It is also called bariatric, a metabolic surgery. It can be said that it is a surgery to treat not only weight loss, but also accompanying metabolic diseases.
So how do you exactly define severe obesity?
Determining the definition of severity of obesity varies from country to country. In general, Asian people tend to weigh less than those in Europe, the United States, or the Middle East. It is difficult to apply the obesity standard to all the countries on the same basis. In Asia, it is more than a certain degree based on BMI. It is set as obesity, and if it is more than a certain degree, it is set as a severe obesity. Although this figure is not important because it can change later, it can be seen that Asia's standards are lower than in the West.
Alright. So now we will talk about surgeries involved in bariatric surgery. What is laparoscopic surgery?
Laparoscopic surgery is not only in bariatric surgery. The surgical method is, for example, whether you eat food with your hands or chopsticks. It is the same as cancer surgery or obesity surgery. In the early days of surgery, he opened his stomach and operated by touching the organs with his hands. But now, laparoscopic surgery allows doctors to operate while looking at the monitor by drilling a small hole in the stomach and inserting a camera into the hole. The reason that laparoscopy is better than laparotomy is because it has a cosmetic aspect, but it does not have to touch or handle many tissues in the stomach, so patients recover quickly and have less pain. So these days, laparoscopic surgery is performed not only in obesity surgery, but also in cancer surgery.
Okay, very good. So who is exactly eligible for this kind of surgery, or for bariatric surgery in general?
Insurance standards vary from country to country, and those who are suitable for surgery also differ. However, it is not absolute because these standard figures can also change. Recently, if there are diseases such as very high or moderate BMI, severe diabetes, gout, sleep apnea, and other accompanying diseases, not just based on weight or BMI, the surgical effect may be judged to be good.
On average, how much time does it take, the surgery?
There are so many types of obesity surgery, and the patient's BMI or comorbid disease determines which surgery to perform. In the case of sleeve gastrectomy surgery, which is performed the most recently, the operation time is not long, around 1 to 2 hours. However, when an additional process enters into this operation, the operation usually proceeds within 3 hours.
And is there any age restriction?
There's not much data on obesity surgery in Korea yet, but age does not mean that obesity surgery cannot be performed. Like all other surgeries, before deciding on the obesity surgery, determine the surgery if the benefits the patient will have from doing it are greater than they will lose in the future. Important factors in a patient's general anesthesia and recovery are not only age, but also underlying diseases, heart, and lung function of the patient. Therefore, if the patient does not have a major problem in safely receiving general anesthesia and recovering, there is no need to limit the number of surgeries based on age. It is implemented that surgery will help treat patients' quality of life or diseases in the future. It is being implemented more in young people than in older people. This is because the risk is lower. That doesn't mean that you can't operate because you're old.
How about a weight limit?
There's no weight limit for surgery. There's no weight limit because the surgery was made for patients with severe obesity, but the higher the patient's BMI, the more difficult it is to undergo surgery and the more likely the patient will develop complications after surgery. In the case of very severe obesity patients, it is recommended to lower the weight as much as possible by using all possible methods before surgery. Exercise, diet control, medication, and other methods are recommended. This is because if a patient undergoes surgery by lowering his weight, the possibility of complications decreases, and it is easier to control the patient's comorbidities. Therefore, there is no weight limit for surgery.
So are there many types of bariatric surgery?
There are several types of surgeries, and they are still being developed. In other words, it also means that there is still no very good way. Surgery is divided into two. There are restricted procedures to limit intake, bypass procedures to reduce stomach eating rooms, and ways to prevent patients from absorbing much even if they eat a lot. Food absorption takes place in the small intestine, which is a way to prevent food absorption by causing the small intestine to skip the absorption process. Recently, it is common to combine these two methods. In the case of sleeve gastrectomy, which I mentioned for a while earlier, is a way to limit intake, and additionally, duodenal bypass and cholanogeno-pancreatic bypass are performed. It is becoming common to use both methods together. In addition, there is rectoplastic bypass as a method that is often implemented. This method uses two methods of reducing gastric capacity and performing gastric bypass surgery. In addition, there are places where methods such as gastric band surgery or balloon insertion using an endoscope are performed, but the effect is relatively small, and the possibility of complications is high, so it is not performed much recently.
So this is a question asked by many people. So does bariatric surgery give you permanent results?
This also depends on the person. In general, the criterion for judging patients who will have a great effect on obesity surgery is whether this patient has seen weight loss effects through exercise and medication. It is judged that those who have benefited from these methods can lose weight relatively well and maintain the effect well after undergoing surgery. In some cases, you can gain weight again due to yo-yo with water. So it's hard to expect all patients to have the same effect. After undergoing surgery, you feel free, and if you eat a lot again without exercising, you gain weight. To maintain the surgical effect for a long time, you need to continue your diet and exercise even after surgery to maximize the surgical effect and maintain it for a long time. And obesity surgery, unlike cancer surgery, is not a concept that solves everything with a single operation. When yo-yo occurs after surgery, it's become a trend to perform additional surgery and to perform revision surgery by adding additional surgery. Recently, a patient undergoes sleeve gastrectomy surgery and undergoes bypass surgery when a yo-yo occurs. Even if the patient has yo-yo, there is a next way.
Okay. So let's talk about the risks of this kind of surgery.
Obesity surgery is not a technically very difficult operation, but a simple operation compared to cancer surgery. However, it is difficult to control the patient's stomach due to a lot of fat, and the patient has many comorbid diseases. So the risk of the general anesthesia is higher than that of other surgeries. If a patient loses as much weight as he or she can before surgery, it becomes easier to undergo surgery, reduces complications, and increases the effectiveness of the surgery. Therefore, losing weight before surgery can lower several risks. Although complications vary from operation to operation, complications such as anastomotic leakage may occur when the stomach or intestine is operated in the stomach, and therefore may be a risk of esophageal reflux disease, infection, or bleeding. However, obesity surgery is not a very dangerous surgery.
So what are the tests needed before doing the surgery?
Since Korea is a country where stomach cancer occurs a lot, patients must perform gastroscopy before surgery. Not only Korea, but also other countries. This is because it is necessary to check if there are other diseases in the stomach and determine the surgical method and surgical availability. CT is performed to check if other diseases are hidden in the stomach, which is also preparation for surgery. Since patients can have several comorbid diseases, if they are obese, hyperlipidemia tests, diabetes tests, and blood tests are conducted to see if pancreatic insulin is secreted if they have diabetes. In addition, obese patients often have mental illness, such as depression, so preparations such as conducting psychiatric treatment on patients before surgery are also needed. In addition, rehabilitation medicine and nutrition teams work together to control the patient's exercise and diet after surgery.
Are there some cases where patients cannot undergo bariatric surgery?
If the patient does not have a willingness to perform surgery or does not have a willingness to lose weight and treat diseases, surgery will not be effective. Therefore, you should carefully choose a patient to operate on. In addition, it is difficult to perform surgery on patients if they have a disease in the heart or lungs or mental illness, such as the risk of general anesthesia, the risk of surgery during the stomach surgery.
Thank you so much, Dr. Seo.
Sure.
Today, we learned many things about bariatric surgery, and the doctor explains in details everything related to this interesting surgery. Thank you for joining us once again at CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.